It's no secret that worldwide there are still millions of people living without access to quality healthcare. In fact, the World Health Organization estimates that 400 million people are living without immunizations, family planning services, and basic hospital access. Many people believe that universal health coverage is a solution. In fact, it's even one of the targets of the Sustainable Development Goals. But what exactly is universal health coverage, and is it even possible to achieve? Well, let's start by busting some myths. Universal health coverage is not free coverage for everybody all the time for everything. It just wouldn't be possible for a country to provide all services free of charge on a sustainable basis. It's not all about money, but it does include all components of the healthcare system, such as the workforce, facilities, and technology. It's also not just about what one individual can access. It's so much bigger than that. It's about services that affect the entire population. So think public health campaigns and national awareness raising initiatives. And finally, universal health coverage is not just about health. Protecting people from the financial consequences of having to pay for health services out of their own pocket reduces the risk of them being pushed further into poverty. So if it's not all of those things, what is it? Well, it's the idea that all individuals and communities, regardless of age or income, whether they're living in an urban slum or in an area of conflict, receive the health services they need without having to endure financial hardship. It covers the full spectrum of quality essential health services, from promotion to prevention, treatment, rehabilitation, and palliative care. To provide those services everywhere to all people sounds like a tall order, but many believe it's possible, including all UN member states who've agreed to get there by 2030. It'll be up to their governments to steer their health sectors towards coverage for all. And how will we know when they've been successful? Together with the World Bank, the World Health Organization has come up with a framework to measure the progress of universal health coverage. This includes measuring the proportion of a population that can access essential quality health services and the proportion that spends a large amount of household income on health. Some countries are already well on their way there. Rwanda has been training over 45,000 community healthcare workers. Thailand has designed its own innovative payment mechanisms, and in Chile, there's free treatment for those who cannot afford the insurance premiums. However, there are many countries, including the US, South Africa, and Belarus, who have yet to successfully make the move. There are a few key ingredients needed to get everybody there. Firstly, a strong and efficient health system. That includes educating citizens on how to stay healthy and having healthcare staff that are able to detect an illness at an early stage and then go on to treat it effectively. It also means being able to provide those who need it with rehabilitation, vaccinations, palliative care, and services for the elderly. Secondly, care needs to be affordable. The idea behind universal health coverage is that when illness strikes, finances don't feel the hit. Governments must find a way to provide care for those in need regardless of their ability to pay. Third, essential medicines and technologies must be made available. As it stands, in many places, there is a limited supply of essential medicines and a lack of life-saving technology. That has to change. Fourth, each country must have healthcare workers who are educated and committed to delivering quality healthcare. And finally, action must be taken to address social issues that affect health and access to services, such as education, living conditions, and income. So, is it possible to achieve universal health coverage? You tell us. Join our conversation on Facebook and Twitter using the hashtag HealthyHorizons.